advancements in technologies are so fast and rapid that many cannot cope up.
That's been the journey over 7-8 years, trying to get it, negotiate with the government, get the money, show the science, work with NICE, which is our body which looks at. But the important part of the journey is also about data.
And for type 1 diabetes, going by your statements, you have to provide them with the best available technologies, which is the most recent with evidence.
So our journey mostly has been about the journey with CGM. We started from 2% uptake in 2017, and now in 2024 it's 97-98%. So everybody with type 1 diabetes have got CGM.
Hello Partha, how are you?
I'm good.
വാസ്തവത്തിൽ ഒരു ഭാഗ്യമുള്ള ദിവസമാണ്. വെരി ലക്കി ടു ഹാവ് ഡോക്ടർ പാർത്ഥ വിത്ത് us.
My pleasure.
അതായത് യു കെയിലെ ടൈപ്പ് 1 ഡയബറ്റീസിൻ്റെ ലീഡാണ് പുള്ളി. അതായത് യുണൈറ്റഡ് കിങ്ഡമിൽ ടൈപ്പ് 1 ഡയബറ്റീസ് ഉള്ള എല്ലാവർക്കും ഓട്ടോമാറ്റിക് ഇൻസുലിൻ ഡെലിവറി കിട്ടുന്നതിന് വേണ്ടി ഒരുപാട് ശ്രമിക്കുകയും ഈയിടെ അതിൽ വിജയിക്കുകയും ചെയ്ത ഒരാളാണ് ഡോക്ടർ പാർത്ഥ കർ. പാർത്ഥ കർ ഈസ് ഒറിജിനലി ഫ്രം ഇന്ത്യ.
Correct.
ആൻഡ് വി ആർ ഓൾ പ്രൗഡ് ഓഫ് യു. And we are also working in the space of type 1 diabetes, but your accomplishments, it is incredible. And for type 1 diabetes, going by your statements, you have to provide them with the best available technologies, which is the most recent with evidence. And I would like to request you to have your success journey shared with our people in Kerala, because in Kerala also we were trying for more than 30 years to provide the best for those suffering from type 1. Just share with us your success story.
So I think, if you think about type 1 diabetes, I think the important thing is we always talk about what can we do to help people do self-management better. Okay? And if you're trying to do self-management better, the most important thing is what technology can give you. So what is artificial or AID, so to speak, artificial pancreas, hybrid closed loop system? All it's doing is making your self-management better. So it's the best thing science can provide at the moment beyond the cure. So our journey mostly has been about the journey with CGM. We started from 2% uptake in 2017, and now in 2024 it's 97-98%. So everybody with type 1 diabetes have got CGM. Now we have started the journey with hybrid closed loops or AID systems. We have started with children first and women trying for pregnancy. Those are our two most important groups. And with children, we have just crossed 50%. So we can see the benefits and outcomes now coming through, HbA1c improvements. So that's been the journey over 7-8 years, trying to get it, negotiate with the government, get the money, show the science, work with NICE, which is our body which looks at. But the important part of the journey is also about data, making sure you collect data to show the importance. So that's been the journey, and it's been very, very good, a long journey, but it's been good for improving type 1 diabetes care in the UK.
I remember until 10 years ago, people with type 1 diabetes and their parents didn't like us publicly making a statement that this is a disease with limited longevity. And this is a fact that in India, even now, those who are suffering from type 1 diabetes, they probably die early. And the recent T20 index data shows that 45 years of life is lost to, that is an average which is lost to a person with type 1 diabetes in the country. And this statement actually should influence the policymakers, because they should be aware that there is a treatment now available for type 1 diabetes, and that treatment 99.99% are not accessible, though only the rich are affordable. But we need to make it more affordable, accessible to, if possible, everyone who is eligible for an automated delivery device. And I repeat this statement, the policy makers or even some of the people in our own fraternity are not aware, because the advancements in technologies are so fast and rapid that many cannot cope up. So that is where I need to get your input on how we can do this in India.
Yeah, so you put 2 points, and I think both the points I need to answer separately. For policymakers, I think the message has to be forgetting the private sector who can afford, etc. I think the policymakers need to think about India is no longer a poor country. India is a country which has got a strong economy, doing well on so many fields. So it should be among their thing that what can we do to provide the best care possible. And as you said, how many year lives are we saving? So if you have got type 1 diabetes, if you live in India, then you've nearly got 44 years when you don't have a healthy life. While if you take it to, let's say, UK or Europe, it's about 15 years or 16. That's the gap.
Oh, that's a huge gap.
That's a huge gap. But the economies are not that different. Because if you look at the economies, you talk about Germany, UK, and India are all same, nearly in the same position, 4th, 5th, 6th. So why is there a big gap in the achievements when the finances are not that? That's the first thing I would say to policymakers. Needs to be aware of the data, aware of the science, and you need to have to make that available. That's the important message. The second thing you mentioned is about clinicians. I think now we need to get to a culture, and what you do with your conference and everything and your advocacy is very important to see. You're saying to clinicians, you have to go and learn this. It's a bit like a surgeon learning about the next development. You don't say, I only did a surgery like appendicectomy and I only do it one way. You learn about more modern techniques. You learn about keyhole surgery. It's the same thing. You're a diabetes doctor, and we are already doing it in type 2 diabetes. We have moved on from sulfonylurea and background insulin. We have now moved on to SGLT2 inhibitors and GLP-1 analogs. Similarly, we need to move on in type 1 diabetes from, it's okay with BD-mix. It's not. You go to basal bolus, you get CGM, you get AID. That is part of your development and learning. I would encourage more people to engage with you and your group and learn from those. And it's got to be part of the future. You have to learn about this if you want to do type 1 diabetes care.
If the government is concerned about the cost of an AID, how is it possible in India to convince them, and what have you done in UK to convince the government?
So I think I always use a very important line, which is think like a patient and act like a taxpayer, right? So the important message there is, if you think like somebody, you would want it. Every politician will say, yes, would like to have it. Is it affordable? It depends as to how much money you want to invest into complications later on in life and the quality of life suffering that you have. So I think it's a mixture of those two things. And I always advise policymakers in different countries to speak to other countries that are doing it. We are available, as you say. I come originally from India. I'm working in the UK. We're very happy to share our data. We're very happy to share our learning. And whatever is needed, have those conversations to see what policymakers can do to take it to the next stage. Finally, industry also has a responsibility about working together with government and finance streams. So that's what we have done in the UK. So, and I think that's what I would encourage. Work together, and there's no reason this can't happen.
I am pretty sure that this brief interview and your smart statements are going to help the community of type 1 diabetes in the country. പാർത്ഥ കാറിനെ കുറച്ച് സമയം നമുക്ക് കിട്ടിയത് ഒരു വളരെ സന്തോഷവും ഭാഗ്യമുള്ള ഒരു അനുഭവമാണ്. നമുക്ക് ഇതുകൊണ്ട് ഒരുപാട് പ്രയോജനം ഭാരതത്തിലുണ്ടാകും, പ്രത്യേകിച്ച് കേരളത്തിലുണ്ടാകുമെന്ന് നമ്മൾ പ്രതീക്ഷിക്കുകയാണ്, ആഗ്രഹിക്കുകയാണ്. താങ്ക് യു വെരി മച്ച്.
Thank you very much.